The American Heart Association says strokes are the 5th leading cause of death and a leading cause of disability in the United States, and up to 80% of strokes are preventable. Well, Dr. Andre Fredieu with Hillcrest Stroke and Neurological Institute joins us with how to recognize the signs of a stroke and how you can lower your risk. First off, thanks for being here. This is such an important topic.
It really is.
And first off, okay, somebody watching this, if they don't know what a stroke actually is, tell us what a stroke is and what it does.
Well, mainly what a stroke is a interruption of the blood flow to the brain. That interruption can occur either via a blood clot forming and blocking a blood vessel, kind of like a rock blocking a pipe. But it can also occur if your blood pressure is too high, where you can actually have a blood vessel that will rupture. In either case, you're losing blood flow to an eloquent area of the brain that can cause an injury.
And it can cause long-term disability as well.
Absolutely. A stroke is the leading cause of morbidity. And so there was a study done probably 25 years ago where it was the highest morbidity was associated with that. People would rather die, lose loved ones, lose a job, than have a stroke. So it is something that will absolutely change not only the course of your life, but the course of the life of your family members also.
Who immediately become caregivers. Absolutely. In a lot of respects.
Yeah.
Okay, so what are some of the things we can do to kind of lower what are the risk factors? Okay. What can we do to lower our chance?
Well, the main risk factors are, and there's a long list of them, but high blood pressure will increase your risk 4 times higher than if you don't, compared to somebody who doesn't have it. Diabetes, hypercholesterolemia, smoking, each of those will increase your risk 2 to 3-fold compared to someone who does not do those things. Atrial fibrillation actually will cause a 4 to 6 times higher risk of you having a stroke. So, the most important thing you can do is just be educated. Know what your risk factors are. If you know what your risk factors are, then you're already ahead of the game, because then you can make a conscientious decision to try to change those risk factors.
And so many people are a little bit stubborn about their health. It's like, I don't need to go to the doctor. I'm not showing any symptoms.
Yeah.
On something like a stroke, you don't want to have those symptoms.
No, you don't.
Because at that point, it's almost too late. Really.
It is. Getting to the hospital as quickly as you possibly can actually allows us an opportunity to change whether somebody has a devastating outcome or whether somebody walks out of the hospital. It's always mortifying for me when I have patients that I see in the emergency room who tell me that, well, my symptoms started yesterday or they started 2 days ago. Well, the possibility of them coming in earlier, they may have reduced their chance of possibly having a fuller recovery.
And sometimes people, they know the warning signs of, say, a heart attack and that kind of thing, but stroke, pay attention to it. There's a little bit of a headache with high blood pressure that feels a little bit different than any other kind of headache. And so get your blood pressure checked. Absolutely, and that's a fairly easy thing. I mean,
I think one of the most important things that I want people to take away from this is that remember to be fast. Be fast in your recognition of a stroke. Be fast in being seen in the hospital. B stands for balance, so loss of balance. E stands for your eyes, so loss of vision, double vision are abnormal. F stands for face. So if you have facial asymmetry, you look in the mirror and it looks like one side of your face is drooped or sliding, that's an abnormality. A stands for arm or appendage. So you can have arm weakness, leg weakness, arm or leg weakness. S stands for speech. So if you're slurring your words or you're speaking a language that no one's ever heard of before, or you're unable to understand speech, all of those are telltale factors of having a stroke. We're communicative beings. And T stands for time. Time equals brain. For every minute the brain is without oxygen, up to 2 million brain cells can be permanently injured.
And it's important for all of us to pay attention for those signs in other people, say our coworkers or our family members.
We should all be stroke advocates. If you're out having lunch and you see someone that slumps over, that's what it's part of the golden rule, and we should want to help others. And so if you have a little bit of knowledge, that knowledge can go a long way towards helping someone to have a fuller recovery.
Absolutely. Well, Doctor, thank you for being here. We appreciate it very much.
It's my pleasure. Thank you for having me.
It's a great topic to talk about.
Thank you, sir.